This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
Okay, so this question is about recurrent bladder infections. And it's weird because it happened to me. And it happened to me a couple times. But mainly it was right when I was started to go through menopause. I started getting recurrent bladder infections. And looking back, I think it was sort of the kind of precursor or one of the things that I noticed happening that was changing. So I want to talk about that. And I also want to talk about what's it called? The cystitis. What's it called? The interstitial
cystitis.
So because I think there's some connection there. And anyway, I want to talk about those two things.
Well, bladder infections occur more to women than they do to men. And the reason for that is that the urethra is shorter in women, so there's a greater chance of bacteria getting up into the bladder.
But why is it like the sudden onset of them?
At menopause?
Yeah.
Because of low estrogen. There are basically two reasons for this happening. The low estrogen, which decreases the blood supply to the estrogen receptors in the body, in the pelvis. So the tissues are thinner, not as strong, not as pliable, and not as resistant to infections. And also because of changes in the acidity of the vagina, the pH, to keep the normal protecting bacteria in the vagina and at healthy levels. And if those change, then there's more likely to get to get either vaginal infections or bladder infections.
And when women just can't get rid of them, I mean, we have those patients.
Well,
what's going on there?
That's usually either an inadequately treated bladder infection or a recurrence of a previous one, and the tissues are a little weaker.
But we're treating them, so we know they're getting treated.
Yeah, but we don't know that they've necessarily been cleared of the infection. The only way of really knowing that is to do a culture afterwards. But I think we've got to look more at what's causing them rather than failures of treatment. A term that is not used these days, but was significant in past millennia, was something called honeymoon cystitis. And women would just get bladder infections for the first time, cystitis being another name for bladder infection. Yeah. They would get it for the first time when they started having intercourse, because in some days in the distant past, they had sex for the first time on the honeymoon. Or they were on their honeymoon and they had sex more frequently. And so it's very, very common for women to get bladder infections when they're on their honeymoon, or actually at any time when there was an increased frequency of intercourse. And that's partially due to bruising of the tissues and diminishing the immune response of the bladder and the urethra. So intercourse is often a stimulation. The other things that can change it are estrogen, as I've said, and changes of pH. It might be due to retaining urine after intercourse. And so one time when, although I said statements that are contrary to this in different circumstances, but that is a good time for women to empty their bladder, is before and after intercourse, because there's going to be more likely to be an infection. So I think when people come in with recurrent infections, we've got to look at what is the cause, what's already going on in the vagina, what's happening about their acidity. Now, two things that are important here is the changes of pH. The pH or acidity of blood is higher than it is in the vaginal tissues. So just after a period or during a period and just after a period, there's a greater chance of infections because of the change in pH. And the other physiological process, if you like, that causes the pH to change is semen. And sperm and semen have a higher pH than the vagina. And so intercourse can act in that way as well to change the acidity of the vagina and increase either bladder infections or vaginal infections. Now, interstitial cystitis is totally different. It's hard to separate them sometimes, but the causes are different. And we actually don't really know why people get interstitial cystitis. There's some immunological response or autoimmune situation. Hard to treat, hard to diagnose, but is debilitating to a lot of women. So there are lots of reasons, and a patient can be absolutely sure if she has a bladder infection, just she feels it coming on. 6 hours later, it's full blown. She has trouble getting in touch with a physician or to get treatment, or the physician may want to do a urinalysis and be sure that it is an infection, or get a culture done so that we know what type of bacteria is causing it, and therefore what antibiotic is best. And patients don't really like to wait for that time, and nor do physicians. So a lot of bladder infections are treated essentially blindly. And if they don't, if that's not the right antibiotic, they won't get better. And yet you do a culture after somebody's on antibiotics, it's not going to grow anything a lot of the time. So it presents a little bit of a dilemma. In those cases that you've treated a patient without a urine culture, you want to get a urine culture when all the symptoms have gone away to make sure that it really is gone. So that's the other significant aspect too.
What about recently somebody died from a bladder infection? I can't remember who it was. A celebrity or someone. But
I'm not sure what you're referring to, but yes,
it was
people
in the
can
news
die.
and people, I remember we had some scared patients.
Yeah.
Yeah.
So
how does that happen?
A bladder infection is exactly that. A bladder infection. It's inflammation of the bladder and the urethra.
Oh, yeah, it was Tanya Roberts that died.
Okay.
Yeah.
If it's not treated, it can ascend. It can go up the ureters into the kidneys.
How long does that take? Are you predisposed or are you?
Yeah. Well, if you don't empty your bladder completely and you retain urine, it's more likely to happen. It's more likely to happen in pregnancy because there's pressure on the ureters from the enlarged uterus. And so there's slowing of the urinary flow out. So a bladder infection can be much more of a problem in pregnancy, but it can also occur seriously at other times. And if you get a bladder infection and it becomes a kidney infection, the symptoms change very frequently, but that becomes more serious, and people can get septic and die from sepsis if they're not adequately treated.
And what are you looking at with that timeline? What is that timeline?
A few days.
Really? So they get a bladder infection and 3 days later they could die if it's not treated?
Right. Yes. That's an exaggeration. It's not usually as quick as that. It's usually a couple of weeks. But it can happen that quickly, certainly. But it's not going to happen usually to people who are otherwise healthy.
Okay.
So it's if their immune response is diminished or they're pregnant. I mean, it's a huge problem in pregnancy.
Really?
Yeah. And so if they have sepsis or they have a kidney infection, it's usually better to give them injectable medications, intravenous or intramuscular, as opposed to a pill.
Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.